So I've been able to squeeze a few more minutes, and the reason I think that's important for you guys is when it comes time to discuss things like signs and symptoms, it's important that everybody's on the same page. It's really not difficult. If it was, I wouldn't be doing it, not gonna lie. So I love drugs, but I'm substance free. And I make people laugh. They always put me in after lunch or after the instructor. They're like, yeah, hey, you gotta help us here. So I'll tell you right now, I've never used an illicit drug in my life. I'm 40, I'll be 41 this month. That being said, I love marijuana. And my chief says we don't need a dog because every time I stop a car and there's weed inside, I'm like, everybody out. I get in, I close the door, AAF, I recline in the seat. I'm like, it starts to wear off a little. You scratch the seat. My partners are like, can we wrap this up? Get out of here, okay? Cookies are over here. I asked for brownies with marijuana, but they said no. And when law enforcement doesn't work, stand up it is. So here's the deal. I graduated high school. I thought I was going to be in the Navy. I showed up. I went down to Springfield, and they said, hey, what do you want to do? I'm like, I either want to fly or I want to be a medic. Like, well, we don't have those two jobs open today. Just sign here. We'll get you something after boot camp. I'm like, nope, not going to happen. And within 2 weeks, I was riding around on an ambulance. So I did start on the EMS side, but of course, my first slide is about my law enforcement history. Why do you want to know any of this? Because sometimes people hear, oh, it's an Athol cop? What does he know? Guys, I make this shit up, okay? Dr. Poteet talked about swearing, alcohol, and sex. I'm like, I'm going home. There's nothing for me to talk about. I started in '96 in law enforcement. What did I immediately do? Every class that they would send me to, I went to. So state, local, and federal, had a great time. And I got into the drug world very quickly. That being said, I cannot grow long hair. It drives me nuts. I don't like facial hair. I had a mustache. You would be very happy that it's no longer here, trust me. And so I can't do plainclothes stuff because I stick out. They're like, yeah, look at the cop in the corner. So I do the enforcement side and the body side, which is why I'm here. I teach in every New England state, and I go as far out as Arizona. Why Arizona? Well, one, that's where Sheriff Joe is. He comes from Springfield. It's a great guy. He has 10 jails in the city, and they do 2,000 intakes a day. Now, he's not proud of the numbers, but it's a reality. So then we go into the holding cells, and we fish out people who have used drugs. And I walk in, and I say, excuse me, miss, what'd you do today? Oh, nothing. I'm like, bullcrap. Your pupils are this big. Okay, you're scratching at your skin. Is it meth or is it coke? Well, it's meth. Great, come with me. I put her in a booth with a student. I say, figure it out. It's like a puzzle. So we travel around New England sharing our knowledge as DREs, a drug recognition expert. There's 6,000 of us in the world, and 1,000 of us come around and teach to you. That's why we get to travel so much doing it. It's a ton of fun. So that being said, I enjoy going around teaching about the law enforcement side. I also enjoy the ambulance side. I have two addictions in life. Diet Coke is one, okay? Ex-girlfriend was all over me about it. I'm like, sorry, I can't give it up. There's no meeting for it. And the second one is adrenaline. So unfortunately, when bad things happen, I don't want to ever see somebody get hurt or somebody's property burned down. But I'm the guy that's like, all right, let's go do this. So that's why I became a tactical medic. I'm not a paramedic. I can still do an airway. I did OR, ER rotations, had a ton of fun, learned about the body, which is what helps me with the body and the drugs, which is what helps me to come and tell you stuff today. So that being said, instead of just being like, yeah, again, what does a cop know about vital signs? I'm going to tell you what a drug does to the body and why. Why do you need to know that as a DCF employee? Because if you're doing a home visit and you're like, I don't get it. Why is there charboy? Why is there little chunks of Brillo in the living room? No, they don't do their dishes in the living room, okay? They're smoking crack, but they picked it up before you got there. It's just so commonplace for them. They're like, oh, hey, get the Brillo out of the coffee table. You're going to understand something about that before I'm done, I promise you. So that being said, behind me is this chart. There's a test on it. So take out a clean piece of paper. I'm completely lying. Okay? 7 categories of drugs. CNS depressants followed by CNS stimulants. They are the yin and yang. Okay? They go after each other. One drops you down, one kicks you up. Then, of course, we get over to the next family, which is hallucinogens. We see a little bit of it, more so in Western Mass. Psilocybin, shrooms, good time. Salvia, it's out there. We finally get it criminalized. Dissociative anesthetics. We come from a unique area of Massachusetts, being the 91 corridor. We actually have PCP issues out here. So PCP is like nothing else. I tell people, if I spray you, tase you, shoot you, and you're still coming at me, my cruise is my only weapon left. I'm leaving, all right? But we have people that use it here, and you need to know. So if somebody's like, well, there's mention that that person uses PCP, don't bring one officer, bring 2. Because if the person starts to go manic or go cyclic, we need to get you out and get us in between the two of you. It's not going to go well. Narcotic analgesics, it's one of the reasons we're here. It's opiates. Everything from the plant-based side, the synthetic side, to the pill side. Unfortunately, we're inundated with it here. And then, of course, inhalants, we don't see a ton of it. It's a really short-lasting high. You might see it from your clients. A kid might say, yeah, I use dust off. I ask recruits all the time, what was your first high? They're like, never got high. You're lying, okay? What's your favorite color? Purple. No, that's a scent, okay? In kindergarten, you were getting high on inhalants, and people don't stop and think about it. They're like, oh yeah, that's right, the scented markers. It's there. Okay? Then when I was in high school, whiteout was popular. They figured that out. Airplane glue had already gone by the wayside, and now it's dust off. Dust off, paints, accelerants, anything that I can get into my body that's a gas. And then lastly is cannabis. Again, personal favorite. Anybody here have family at Yankee Candle? Nobody? Put it in the suggestion box every trip. They'd sell it. I'd buy a case. I'd hang it in my cruiser. This guy, these tables here are laughing. You guys are like, Narcan in the back, all right? So what is it? What's a drug? You tell me. When Dr. Poteet was up here, although we're very much on the same page, if I said to her, what's a drug? She would name all sorts of different things off. And then if I got to scented marker, she'd be like, no, not a drug, but it is abused. So it's any substance which, when I take it into my body, it impairs my ability to do something. It impairs my ability to drive carefully, to learn in an academic environment, to correctly take care of my children. What is it? How do we get it into our bodies? So this is where everyone's going to be like, whoosh, nope, not raising a hand. How do people get drugs into their body? Come on, laughs a lot. Let's go. Now they're like, nope, not doing it. All right. Do we ingest? Thank you. Through my mouth. I'm going to swallow down a drug. Is that a desired way to get it in? Sometimes. What's the issue? Esophagus, stomach, 25% of the drugs of ill effects, or what you're looking for to get high, gone. Because the amino acids are like, hey, look at this, pow, pow, they beat it down. Finally it gets into the intestine, the bloodstream picks it up, and it's like, hey, welcome back, drug. Where'd the rest of you go? Okay, so yeah, oral intake of drugs is one way. It's a pretty decent way. How else? Inhale. Okay, so I'm going to inhale a gas, or I'm going to take a solid and I'm going to inhale it. And we're going to come back and talk about inhalation in just a minute. How else? Inject, okay. So injection, a lot of people say once I went to the needle officer buck, I could never get off of it. I sit down with addicts every opportunity I have. What do you want to eat? What do you want to talk about? Let's do it. Sit down with them. What do you take? How'd you take it? When did you first start? You know, what's the high like? How's it feel? Talk to them. So injecting. A lot of people go to needles. In 2009, we decriminalized needles. I worked at UMass Lifeline at the time. We were absolutely against it. And now I look at it and say, wow, we were so short-minded. Why were we against it? Because we didn't want a ton of needles out on the street. They're already there. But I guarantee you, if you've been in this game since prior to 2009, what have you started to see on the police log more and more often? Caller reports, needle at the playground. Caller reports, needle on the side of the road. Caller reports, needle on the sidewalk. Why? Because every single person in here can go to CVS, Rite Aid, Kmart, Walmart, and buy it. Anywhere there's a pharmacy, proper ID of 18 or older, you can get a needle now. So people are a lot easier at just discarding them. So it was a double-edged sword. Infectious disease went down to an extent, but now we're finding needles everywhere. So I've heard inject, oral intake, inhale, gas, what else? Excuse me? One more time. Enemas? Thank you. Backdooring, right? Nobody wants to mention the backdooring. Okay? It's popular. It's popular with your clients, teenagers. They do it. Okay? People who are afraid that they're going to get caught. So rectal or vaginal drug use is actually somewhat common. Cooley Dickinson Hospital inundated 2 years ago. Their med director's calling. He's like, what do we do about this? Like, you change your patient assessment. A little more quickly, we start to look at alternate routes. What else? Patch, yep, transdermal. It's a great thing, except for when you're going through somebody's stuff and you get something that's transdermal on your hands. Okay, rule number one, we disarm. So if somebody gets into something like, ooh, not really sure what that is, hand over the gun. Okay, because 10 minutes, 15, 20 minutes from now, you might think you see different colors, different shapes. It's not really a lot of fun for us. So I'm going to go back to the inhaling, and some people bring snorting in the same way. The fastest way to get a drug in, some of you might have thought that it was injecting, and I completely understand why, because blood's always circulating, arteries out, veins back, goes round and round, is inhaling a vapor. So some people think, well, that's just inhalants. That's the sixth of the 7 categories. Absolutely not. I could take Percocet, put it on tin foil, light it up, breathe in the vapors, and get immediately high, because it's a 1.5 second path. It crosses the blood-brain barrier immediately. So when you talk to someone, you're like, hey, so what do you do? And they say, oh, I'm using heroin. Okay, next question, how do you use it? Are you drinking it, snorting it, smoking it, shooting it? How are you getting it into your body? Just some different things you need to give some thought to. I teach the top 1 to 9-year-olds. What's a drug? Any substance other than food that affects the way your mind and body work. Okay, we can sit up here and talk about marijuana. It's probably going to be legal next year. I don't agree with it, but whatever. Change the rules. That's all we do. They give me a new law manual. Hey, these are your updates. Marijuana no longer illegal. Marijuana less than an ounce, don't arrest. Okay. Just tell me the rules I got to play by. But here's the problem. People are like, oh, hey, it's natural. It grows in the earth. Okay, without, pointing anybody out in the crowd, there are some 40 and 50-year-olds amongst us, okay? And there's probably some 20-somethings amongst us. My sister is 10 years older. She or her friends paid $2 a joint for marijuana. When I was in high school, it was probably 2 to 3, 10 years later, not a big inflation. Now kids, in order to buy enough weed to roll one good joint, are spending $5 to $7 to $10. Yeah, so you're like, whoa, wait a minute, what happened over these past 20 to 30 years? THC that was down in the teens is now in the 35 to 50 percentile of active ingredient. You can hallucinate from marijuana. And in fact, you will if you get good stuff. And I know you're like, well, I can't believe a cop saying it's good stuff. If you get potent THC, you're off. You're going to hallucinate. So it's a different world. That's something we're going to talk about. And lastly, if you're dealing with kids that are in schools and they're violating handbook agreements, you've got to look at this. This is the Athol High School. So any drug is defined under 94C, which is our Controlled Substance Act, and it goes on to say, as amended, or potentially mind-altering substance that can be what? Smoked, ingested, injected, or inhaled. So pretty much anything that can get you high. That had to be changed. What's not there is alcohol. It's still against the handbook rule, but it's not under 94C. Guess you could say ingested. But again, the kids going to the school dances, they know that they might get a PBT at the door. They might have to give a breath sample, so they soak a tampon in a high-dose alcohol, insert it into their orifice of choice, and then they're in the dance getting drunk, and it takes you a little bit longer to find it. We've talked about the 7 categories, so let's talk about this. Oh, you can't get past that, can you? Guys, it happens. I talked to 2,000 kids in Easton High School just before they went on summer break, and they're like, he said tampon. It is what it is, okay? You got to know how they're getting it in. What's the most widely abused depressant or drug in the United States? It's CNS depressants. It's alcohol. That being said, you show up in a home for a home visit or investigation. Excuse me, Mom, Dad, how many drinks have you had tonight? I've had 2. Okay, what's your next question? 2 what? All right, how big? Think of the last time you guys went out to dinner. Yeah, bartender, I hate beer. I know, throw things at me now. Like I said, you guys just open the can first. Doesn't hurt so much. I sit down, I'm like, yeah, can I get a hard cider? Sure, 16 or 22. Well, let's go big, right? YOLO, you only live once, let's do it. Like, I'll take the 22, please. And out they come. So now I get stopped, 3 22s, right? 66 ounces of alcohol, no big deal. I get stopped by a trooper on the way home, and he's like, hey, Buck, how many have you had? I had 3, I'm not lying. 3 what? 3 22 ounces. Oh, different story. I've ingested 5 drinks. That's something that you need to give some thought to. So if it's a regular standard run-of-the-mill alcohol, if it's a bottled or canned beverage of beer, not a microbrew, we're looking at 12 ounces as a serving. So ask the parent, how many? If they say I had 2 and it's like, yeah, 2 pitchers at the bar on dart night or pool night, then it's going to be reflected differently in your report. What's up with the next glass? Well, now we get into the microbrews, okay? The highest beer you can get is 14%. Somebody in here is like, nope, not true, just at Brewfest. You're wrong. Yeah, you can get hybrids that are more, but as far as a fermented beverage, it's 14. After that, yeast dies off, it becomes distilled, and off you go. Wine, the wine drinker. Who here pours 4 ounces? Not many. If you were a waitress in high school or college, maybe you did, but everybody else, no. All right? It's just the way it is. People have big glasses. I might do it in a pint glass. I don't get points for it, but hey. I drink white, so I'm already losing points. And then the hard stuff, 1.5 ounces, okay? 1.5 ounces. So now I'm gonna test you. You go to the bar, a non-chain restaurant, because they're cheating you all day long. All right, you go to your favorite bar on the corner, Garrity's Pub. Yeah, hey, can I get a Long Island iced tea? There's 5 shots in that. You have 2. Dad comes stumbling in or mom comes stumbling in. Oh, hey, surprise home visit. Crap, glad I only had 2, right? Gum goes in, you sit down. What'd you have? 2. 2 what? 2 Long Island iced teas, 2 Grateful Deads. That's 10 shots. okay? You've just got to think of your line of questioning. I'm not trying to make you cops. I'm just telling you, don't let them skate the information. Nobody tells you what they have. You know, what's in the car? A joint? Well, what else? A bag? What else? A grinder? Can we just go to the end? All right? Tell me what you've got. What do people look like that have been drinking? Red, glossy, bloodshot eyes, stumbling fingers, dexterity, right? The frontal lobes. Brown University did a study. The brain's not done forming until age 24 to 25. You heard 25 today. And you know, that's that instant satisfaction. That's the happy area of the brain. So people drink, and the younger the brain, particularly teenagers, it takes 7 days for the alcohol to completely leave the brain. Now, that being said, your liver can metabolize, particularly a healthy adult liver, can metabolize 1 beverage per hour. Something else you need to give thought to. You do the home visit, and I say, yeah, you know what, I had 3 12-ounce beers. The remaining 3 are in the vegetable drawer in the refrigerator, because why would I put vegetables in it? And you go, and you're like, yep, 3 cans. He's not lying. But you're the only one here to take care of the kid. Maybe an officer like I will show up. Hey, I got a PBT. Let's see what he does. Boom. It blows out at an 06. Okay, that's consistent. In 3 hours from now, he should be a 0-0. Okay, great. It helps you to realize how long it's going to take for the person to be a 0-0. You know, what's your triggering BAC that makes you go, nah, we're not going to let you keep the kid here today? I don't know. For us, it's a 1-0. You're a PC. You get to a 1-0 or higher, or you're falling down drunk, we're taking you. After that, we have to make some decision making. You know, did you take anything else? Is it a polydrug case? So on and so forth. But we're all familiar with the alcohol impairment. So my question to you, although I've kept you laughing for 20 minutes, is how do you know you're drunk? When do you know you should be going to water? Nobody wants to admit it, okay? If you think the person at the end of the bar is absolutely staring at you and like wants your number, slow down, okay? If you think you can dance and you're a guy, sorry guys, throwing us under the bus, easy killer, right? Even worse is karaoke, you're like, I got this song. Don't do it. And my personal favorite is when you look at the guy at the door and you're like, oh, I could kick his ass. He's been drinking water all night. You've been hitting the hard cider. Probably not a great idea. Just saying. So while we're at depressants, let's talk about this, because most people don't give it thought. An antidepressant, anti-anxiety, antipsychotic medication is also a CNS depressant. Why is that important to you? Because if I'm at home taking Effexor or Abilify or Paxil or Prozac or any of these other great medicines, I love them. When they're needed, take them. That's awesome. But then I tell you, yeah, I also wash it down with 3 rum and cokes. Well, it's not 2 pills plus 3 rum and cokes equals 5. It's a synergistic. It's a multiplying effect. So I can't say to you, hey, the person's in 06 with two Effexor on board. I'd give them 4 hours. They're going to be fine. You're never going to hear that from me. Because when it comes to mixing or polydrugging, even though traditionally we think polydrugging is different categories, this is the same. It's multiplying. I can't look at you and say, we're good all day. Now, the other thing that some people are kind of surprised by is why is it that antidepressant, anti-anxiety, and antipsychotics are in this family of drugs? Because if I'm sad, and I always use myself as the example, let's say I get some bad news, the phone goes off, hey, you know, so-and-so in your family passed. Yeah, it sucks. You're losing your job today. Wow, that really sucks. So I go to the doctor, he or she gives me some pills, and a month from now I get picked up by another department, but I'm still taking those pills twice a day. Okay, it's all about homeostasis. If my mind is crashed down, I tell everybody, think of neutral as 50. And so when I started the lecture, I was at a 50, and all of a sudden, you know, Marissa's in the back going, dude, get off stage, you're not doing it. Okay, I'm gonna come down to a 30. Well, my medicine's like, hey, don't worry, brain, it's okay, I'm gonna come join you. The vital signs come down to 30, and now I'm level again. I'm like, oh, it's okay. Crashed and burned at one speaking engagement. No big deal. I'll do another one tomorrow. And I leave. Well, if that happens for a month and all of a sudden I'm over the loss of my job, but I'm still taking that medicine, my brain's back up to a 50, but my body's still down here at a 30. I'm now chemically imbalanced again. So this medication's great. So you should talk to your parents or your clients and say, hey, you know, you've been on Effexor for 3 years. What started that? And have you talked to your doctor about maybe weaning off or changing your dose? We need to look at that. Because the person's still likely chemically imbalanced, it's not going to go so well for them, and it's certainly going to make your life with them more interesting. Soma muscle relaxers. Soma's one of the worst. I've had a Flexeril and Scalaxin after a cruiser crash. They all cloud your mind, no matter what they say to you. No, this one's good. You're okay. I carry a gun. Okay, I need to have sound mind. Get me off the meds. Get me back in the car where I'm happy, and we'll keep going. But if somebody says to you, yeah, you know, I do take a muscle relaxer once in a while, and you're the only person home taking care of the child, what's that muscle relaxer? How many milligrams? How many doses a day? If it's Soma, That is bad news bears, all right? I watched somebody walk across a parking lot. It took them about 3 minutes. I could finish gassing my cruiser while everybody pointed. I'm like, shh, leave her alone. It's okay. Finish gassing, walk over. Hi, how are you? She was on Soma and Ambien XR. So she was on a very interesting cocktail. But, you just got to give some thought to it. So when you hear the medicines that either the child's taking or the parents are taking, just do a little bit of reading up on it. Call me. My contact info is at the end. Everything except for my actual telephone number, because apparently this is going to possibly go on to a site where other people can find it. I'll give it to you. If you want to call at 2 a.m., say, hey, I'm on a home visit, and this is what we just found in a bag. What is it? I'll tell you. My next favorite is cannabis. Why? Yeah, remember, it's the 7th category over, but the reason that I brought it up here with depressants is because they pretty much go hand in hand. They're very socially acceptable. I'm certain you go to a lot of houses where people say, yeah, we use weed, whatever. Medicinal marijuana's out there. That means they can lawfully use it, but that doesn't mean that they can lawfully use it in close proximity to others. I had a medical marijuana person in the passenger seat of a car the other day during a traffic stop at a neighboring agency, and they called and said, listen, I got an issue. She lawfully has it, she's lawfully using it, but the driver rolls it for her, hands it to her, and she smokes it as they're driving down the road. Go back to high school, they're fishbowling. I'm like, no, he's not driving, okay? Well, not to mention he uses Oxy twice daily. He's off. If you're not going to take him as an OUI drugs because he's not a huge mess, he's still not driving away. So we'll address that through other means. So let's talk about marijuana. How do people use it? My mother, I love her dearly, 73 years old. She's so sweet and innocent. She's like, so honey, what do? Do they dry out the leaves and crush them up? Like, that's exactly what they do, Mom. Like, no. There's these things called buds. They're clusters. They grow on the plant. She's like, tell me more. Like, well, then they trim those up, and they grind it up, and they sometimes roll it, or they pack it into a bowl, and they do a number of different things with it, and they smoke it. She's like, oh, did you ever do that? No, I didn't. But Jason, Susan, and Kristen, all the time, right? Yeah. You got to get the heat off of you. So look at the image on the left. What do you see with that marijuana bud? Again, you're like, hey, my boss is here. I'm not answering. How do you know that's good weed? I know it's good weed if I can smell it from feet away. Okay? Just on odor, I'd be like, that's good stuff. That's Granddaddy Purple, that's Hindu Skunk, that's this, that's that. And there's an app for that, in all seriousness. Leafly, you can look it up. It costs you $3.99. I use it all the time. Because if you walk in, you're like, hey, I smell weed in this house. Is that Hindu Skunk? And they're like, oh, crap, she knows. Okay? They're going to tell you more. So how do I know this is good weed? Look at the hairs and the crystals. That's what gets you high. That's the most potent THC. Everybody's like, no, I trim off the bud, I pack it into a bowl, I smoke it away, and off we go. All right, that's great. It has THC in it. But if the next image or the next slide I'm going to show you is a grinder with multiple levels and a screen. And it's going to show you how to collect this powder or this pollen or these crystalloids, depending on what you want to call it. The image on your right is something called waxy weed. You didn't hear about it until about 2 years ago. We also call it dabs on the street or butane weed. And what they essentially do is they take a test tube that has a pre-manufactured hole at the bottom, and it's a small hole, and they pack the tube full of marijuana bud, so they've trimmed it off of the buds. They get rid of the seeds and the stems. We can use that to do something else later. They pack this tube. They put a coffee filter or 2 or 3 on top, usually an elastic. Somebody a couple weeks ago actually took a pipe clamp. They flip that tube over, they take butane, a refillable butane can, they put it in that pre-manufactured hole, and they apply an angled pressure, which causes the butane to blow its way down through the bud, down through the vegetable matter. And as the butane's going through, it makes something called butane hash or weed or butter. And it pushes its way down through, and once it's clear, okay, now I'm just getting all butane, there's no more crystalloids coming off. And they collect it in a pan. Now, why am I telling you this? Because you could be doing a home inspection and say, Pyrex 9.5 by 12, what is that in there? If it's shatter, what they do is they just let it dry, they break it up, it looks like peanut brittle, and they smoke it. But the problem is there's still a lot of butane with that THC, so it's highly flammable, it's very dangerous. And they're polydrugging because they're getting THC with one breath, and they're getting the volatile solvent of butane with the other. So it's very high. It's about 80 to 90% THC. So remember, when you were in the 80s and you were smoking THC like 11, 13, 15%, and now you're hitting 80%, it's a lot better, all right, or a lot worse, depending on how you want to look at it. Sorry. So that being said, that is wax weed. What do they store it in? Lip balm containers. The little blue screw-open top lip balm containers, they like to use that. A corrective lens, contact lens case. A lot of kids carry just one. Well, most people get contact lenses. They end up with two, and there's something inside of it. The EOS, the little pink egg for the lip balm. There's a lot of things that people are using out there. Now, this is that powder and that multi-layered grinder I told you about. So people put their vegetable matter in, they grind it back and forth. It comes in smaller pieces. They roll it, they pack it into a bowl. Sometimes they still use a bong. We'll hit that in a second. And then sometimes they make the butane or the shatter out of it. Now, let's talk about bongs for a minute. What did your college roommate, not you, put into a water bong when smoking it? Water, right? Now, what do they do now? Bacardi 151, Everclear. So now I'm smoking alcohol and I'm smoking marijuana at the exact same time. What, 10, 15 minutes ago, I asked you, what's the best way to get a drug or the fastest way to get a drug into your body? It's a gas vapor. So instead of you leaving the water in it, you put in a high-dose alcohol, and now they're doing that. Again, something to give some thought to. So here's an eye of somebody that's been smoking marijuana or some drug in the cannabis family. So it includes hash, dronabinol, Marinol, some of the pills if they start to smoke those. What do you notice? That pink clouding, conjunctiva, conjunctiva, depending on how you want to say it. Okay? It's not red glassing and bloodshot. Those are pink clouds. I say bloodshot as a lightning bolt. So if I'm looking at somebody that's been consuming alcohol, I see the lightning bolt issue. If I see somebody that's been smoking, there we go. And although you don't have to take any notes, just commit a couple things to memory. 4 drug categories affect the eyes. 3 of them dilate it. They make it large. Okay, I call them pie plates. Cannabis, stimulants, and hallucinogens. They're your cash drugs. They're your money drugs. So if you smoke weed, you're going to have dilated pupils. You hit a stimulant like crack cocaine, powder cocaine, methamphetamine, you're going to have big dilated pupils. And lastly, hallucinogens. So salvia, psilocybin shrooms, peyote, things like that. They're the only drug categories that are going to dilate, and then of course narcotics are the only ones that constrict. Well, why do I put these people up here? Because this is down at the Comcast, Tweeter, whatever they're going by as a name right now, the tongue. So if you suspect, hey, this apartment or this house really smells like marijuana in a burnt or burning state, and I want to find out who in this family is using it, then when you're doing an intake or an investigation, say, excuse me, sir, ma'am, do me a favor, just close your eyes, stick out your tongue like you're at the doctor's office and go, and they'll do it. And you're looking for this, because if I'm smoking through a bowl, a bong, a water bong, or a water bong with alcohol in it, I'm likely going to get the discoloration to the tongue. The other thing is, you're also going to see enlarged taste buds. So you're like, wow, this guy's really off the charts. No, it's just a matter, it's all free evidence. It's all free information. Just, open up your mouth, stick out your tongue and say, I just want to take a quick look. Look up the nose. There's a number of different things you can do. The image on your right is a finger, while actually fingerprinting someone. And this kid was a great kid. He said, you caught me. I've been trying to deal for 2 days, and I'm already caught. I said, you got to go to a different job, right? You're not good. He had great product. You're not good. So as I'm fingerprinting him, I go, look, your index finger. He goes, yeah. He was picking the sap out of his own bowl, out of his smoking apparatus, with his unprotected finger. I'm like, yeah, buddy, it sticks to your finger. He's like, yeah, I've been trying to get it off. Again, it's all evidence. What's this? Ugh, I know, hey, it's post-lunch. Brown tongue, okay, brown discoloration, smoking marijuana and Percocets, bouncing off the guardrails in the Jersey barriers on Route 2 out in Central Mass. They call, say, hey, I need you to come in, tell me what this guy's using, not a problem, be right there. So again, if you get some observations of the body, give me a call, and we can tell you what they're consistent with. Now, why is this up here? This is not a that-a-boy. $1,200 is nothing. I wish the detective lieutenant was still here. We had a bust of 80 grand in cash. Marijuana is a huge moneymaker. So when people are like, yeah, let's legalize it, guess what? The dealers don't want you to, because they're making huge profits. They grow something outside, they grow something on the power lines, they have a hydro grow in the house, and they're making big money. The reason this is up here is because this was a teenage party with an unsecured firearm, lots of weed, and a gun. All right, so we deal with that. We take everything with us. They try to say it was for personal use. Now, I happen to like food, shocker, right? So let's say Doritos were a favorite once upon a time. You buy a bag of Doritos. Nobody in this room goes home. It's like Monday, Tuesday, Wednesday, and makes out these little bags. So he's like, yeah, that's personal use. I'm like, really? No, I don't buy it, all right? Give some thought to what you find or what we tell you we find in a house. That's not personal use. The image on the left, again, street encounter with a teenager. Okay, different folds of money. $20 folded up into quarters in one pocket, the rest of her money sequentially in the other pocket, a digital scale, some trimming shears. Nothing huge. 35 millimeter canister, gone, right? So again, for some people in the room, their friends kept their marijuana in a 35 millimeter canister. What's changed over the years for us? Now everybody has a digital camera, okay? An SD holder doesn't hold a lot of weed. So they put it into something else. Baby food bottles, M&M mini containers, the little hard plastic containers that make that tight seal. It's a great hide. You're looking at someone's bag before you take them to one of the programs, and you're like, oh, yeah, okay, candy, yeah, feminine supplies, lipstick. No, take it out, twist it, make sure it is what it looks like it is, okay? There are nip bottles out there. I can pour an ounce or two of alcohol into a plastic nip-looking container, put a cap on it, put it into a plastic sleeve that says Tampax 100 times, and seal it. And you're like, oh, I thought those were supplies. They're getting something past you. This is another one, and again, they're just here to show you what teenage-run houses have had in them for drugs. This one, you've got you got a marijuana grinder, a bowl, a bunch of lighters, multiple scales. You know, his PS2, PS3, whatever controller is never a gamer. Open box of sandwich baggies. They're all indicative of marijuana distribution. But this was alarming. 11 unsecured firearms. Okay, dad lives with his girlfriend out of the area. Essentially said to the kid, you and your friends can crash here, just don't wreck the house. So again, if you're going to do a home visit, hey, where's dad? Oh, he's at his girlfriend's. He said we can call him. Next thing you know, things like this are in the house. I just want you to be careful. And then the last one, because this was last week, again, another teenager. Yeah, oh, my bag smells funny. Yeah, you got marijuana in here. You know, it was post Miranda. He's like, yeah, I got a couple ounces. Okay, so we're at a criminal weight. Scale, baggies, a lot of money. I mean, if anybody here has got $800 in their pocket, we can go to lunch anytime now. So most of us wouldn't have it. But again, these are little low-level street encounters. And then I just want to call your attention to the top right corner for 1 second. That's a works kit. All that means is any instrument or item I need to use or ingest or inject a drug is going to be in something that you don't immediately look at and say, that's drugs. This was a Case Logic external hard drive case. It's designed to hold one of the 1 or 2 terabyte hard drives. But he took that out. He's got his tin foil in there for smoking cocaine off of it. He's got his straws for chasing the dragon or breathing in the vapors. There is some cocaine in there in a corner baggie. You just got to stop and, again, open, shake, squeeze, do whatever you need to do to any container that's in there. So we go from alcohol and cannabis over to stimulants, CNS stimulants. Cocaine is the one that we're going to bump into the most. And with cocaine, what do we generally find? Mostly powdered HCl cocaine. It's still pretty popular. 80s and into the 90s, yes, we're dealing with a lot of crack, a lot of rock out there. It's still out there, but what people do, it's funny because it spreads their product, and I don't mean funny in a humorous way, please excuse me for that, but they'll buy powder, they'll mix it with baking soda and water. I want to make sure that Channel 22 is not here right now, so it's not out there for everybody. And equal parts, and then they cook it, and they make these chunks, which are rocks. And now somebody buys it on the street, and they're either going to smoke it in a pipe with that Charboy, that Brillo that I mentioned to you, or they're going to put it into a spoon with some water, and they're going to try to cook it back down to an injectable liquid that they're going to draw up and shoot. Now, what's unique about cocaine, or the stimulant family, is you can get it in powder, you can get it in rock, you can get some liquefied stimulant drugs. And so you have to look at the methods of use. They're either going to snort it, smoke it, or shoot it. Okay, this is not a transdermal drug for the most part. You're not going to have to worry about accidental exposure through your skin, and they're generally not inserting it into any orifices. That being said, the paraphernalia around it has changed a little bit. The small mirrors, we're not finding them a lot anymore. I used to find them all the time 20 years ago. They fit perfectly in the back of a cigarette pack. And now what we're finding is people are literally doing lines of these drugs off of their smartphone screens. We're finding it off of CD cases, off of mirrors in the house, off the back of toilets or urinals. Any surface that is hard that they can chop it up, they're going to go ahead and snort it off of. And lastly, I want you to be most concerned with the needle, because an accidental needle stick is a life-changing event. In my years with Worcester EMS and Life Flight, I was dating a young woman out there who was a flight doc, and she came in one day at work. I'm like, hey, how was things? I heard, you went out on a few flights. She's like, yeah, we need to talk. I got a needle stick. Whoa. So just stop and give some thought as you're searching things, going home to your loved one or your partner and saying, I got stuck today. We did a removal, and I was checking the kid's bag of clothing, and I took a needle to the hand. We need to stop and talk. It is life-changing. So not to drop you down from the laughter I had 20 minutes ago, but you've got to just give some thought. Before I touch anybody's stuff, anything in this bag that's going to cut me, poke me, or stick me. Nope, are you sure? Because if there is, you won't get in trouble for it. Just tell me now, before I check your bag. If there's a spoon with charred resin, as you see in this image, there's a sharp somewhere, okay? And they put them everywhere, literally everywhere. Folds of pants, cufflinks, down between the butt cheeks, shirt collars, found them in a million places. Be very, very, very careful. Now, the works kits for cocaine, depending on if I'm shooting or snorting or smoking it, it's all going to be different. Pieces of tinfoil, okay? Where does tinfoil belong? In the one drawer in the kitchen, sometimes in the fridge. If you're checking a kid's bag or his room and you see tinfoil in there, it's not there for a good use. Short of having the remaining impression from being on a bowl, it's not there for a good reason. And the young man who had it in his works kit the other day, he was just smoking off it. You could smoke anything off this. Give me a Percocet, I can smoke it off of tinfoil. Give me a rock of cocaine or some powder cocaine or heroin, I can put it on it and smoke it. So tinfoil should be a big tell for you. Some type of a lighting surface, some type of cotton they're going to drop through. A cotton ball, a cigarette butt, or unfortunately at an overdose recently, I had the individual who plucked the cotton off of Q-tips. Anything is there. So just keep your eyes open. Something to restrict the blood flow, a tourniquet, a belt with teeth marks. Again, I had a dad say to me, I can't believe it, after I sat through your class, I went home and sure enough, there I found some bite marks on my kid's belt. Like, I'm sorry, but you know what that tells you. Bring him to the doctor, get him tested. Start searching his room, just be careful. Because if he's doing the blood flow restriction, he's obviously injecting. Now, with stimulants, again, it's a cash drug. It dilates the pupils. So you get these huge pie plate pupils. They're sweating. All right, they're diaphoretic. They're picking at their arms. They're anxious. They can't control their jawbone. I don't know why you're here. Just leave me alone. I don't want to do this anymore. They're all over the place. And then you look at their arm carefully and you say, oh, wait a minute. Goosebumps. It's called a piloerection, all right? If you got somebody that has to sound funny in their report or very tricky in their report, I then observed the hair standing up on end. Yeah, guess what? That doesn't go with being cold. That goes with a month from now when you go out to work and you're like, ooh, it's a little cold, and you get a goosebump. I'm sorry, it doesn't go with being hot. It goes with being cold. So if somebody's using cocaine, they're dripping sweat, and they have goosebumps, you know they still have a psychoactive drug in their body. You've got some issues. So just look, the body's not matching. Red, flushed skin, dripping sweat, goosebumps. What are you taking for a stimulant? What did you use today? Oh, nothing. How do you know? What are you talking about? You'll get through it, I promise. Homemade crack pipe out of a nip bottle and some tin foil. The pharmaceutical side, and you're going to end up with this, particularly those of you that bring kids to programs. Ritalin and Adderall are amphetamine salts. They cheek their meds. So I know the people inside the programs, they make them, okay, open up your mouth, say, lift up your tongue, left, right, so on and so forth. There's a big market for this. If I can get my prescription pills out and sell it to my friends or family members because they want a cocaine stimulant like high, but they don't want to go out and score crack or powder cocaine, then this is going to do it for them. It has the same effect on the body. Now, meth. Okay, prior to last year, I would have said to you, no meth here. Meth in Arizona, all day long. I sit down and talk to them about meth like I sit down and talk to people here about cannabis and heroin and pills. And last year, someone came to my station. He called me first. He said, I think one of my tenants has a meth lab in the apartment. Like, I really don't think so, but I'll listen. Come on, come on down, talk to me. What makes you think that? Because somebody else came to me and said he hired 4 people to go to Walmart, CVS, Rite Aid, and Hannaford with him to buy all the Sudafed that they could. Now, you're only supposed to be able to buy 2 boxes at a time. I'm like, oh, crap. 2 times 4 is 8 times 4 stores. Now we're at 32. Here we go. Yeah, you know what? We've got an issue. We investigated it. Sure enough, it was a mobile meth clinic. Now, one thing I guess we can say we're fortunate about is that it's not a native Massachusetts drug. It's a very rural area drug. This cooker came out of Maine. All right? I'm not sharing anything that's secret. Anything that I'm going to tell you is probably in a press release or you've already heard. So he was out of Maine. But now we get another one this year. And it was a larger scale operation. And that one was from Florida. So as we have people moving up, or when you're talking, you say, other than mom or dad or partners or grandparents, or who else lives here? Oh, yeah, my Uncle Pete just moved back up from Tennessee. Oh, really? Tennessee? Huh? What's Pete do for work? Nothing. All right? Ask some questions. Find out where I'm from. Find out when you do the criminal record checks. I know you guys, we get the information requests all the time. Yeah, can you run a triple I for me? See if he has a criminal record out in Tennessee? Oh, of course he does. Manufacturing something. All right? Don't stereotype, but when you're talking to the person, just look at their physical features. Go on to the Faces of Meth and take a look. I happen to see it with booking photos. Hey, I locked you up 10 years ago. I've locked you up today, and you don't look like the same person anymore. And it's not a little less hair and some gray hair. You physically look very different. What's going on? You wouldn't understand, Buck. Well, talk to me about it. Let's go, and we'll talk about it. So, the opiates, heroin. What's changed? 20 years ago, I stopped a guy. He had just come back from Holyoke. Sorry, guys. I know I got a couple Holyoke brothers and sisters in the room. Bought 2 bundles, okay, $200 worth of heroin. Shot one up. I grabbed him for speeding. Speeding and heroin don't go hand in hand because usually you're lethargic and nodding off. Stop him for speeding, get into it, couple guns, get some heroin out of the car, and off we go. Well, heroin was very expensive, but the potency wasn't that great years ago. And now it's very cheap, and the potency's climbed through the roof. And the packaging has changed. We used to get it in bindles or folds or magazine folds. So I want you to stop and think about some of the different magazines that you might buy. So I'm not going to ask you to raise your hands, but if you buy something like Cosmo, you're familiar that the pictures are much brighter there than in other magazines. Or, Time. Hey, that's a really nice, fine paper that they use. And then you pick up, one of the newspapers, the campus newspaper on your way out. You're like, wow, it's kind of coarse. Well, if I'm going to use heroin, it's a very fine, fine powder drug. I want to put it on a surface that I'm not going to lose any product on. So that's why they use the wax paper, the tin foil, those high gloss magazine pictures. They cut them out into little 2 or 3 inch square pieces. They put a bump or a dose or a hit of heroin inside of it. They fold it over onto itself and fold it over onto itself again, and they put a little piece of tape on it, and now you have a bindle of heroin. So most people during these lectures say, what's a bindle? What's a bump? What's a hit? It's about enough powder to cover your pinky nail. That is one hit. And it still costs $10, sometimes as low as $5, sometimes $2 to $4. All depends how much they've stepped on it, how much cut they've put into it. When it comes to us pure, it's white. They put some mix or some cut in with it, and now it's getting into tan or gray. When it gets to brown, they've really stepped on it a lot. They've put a lot of other substances into it. So the price is coming down. Now, I can tell you easily in the past 5 to 7 years, some people have gotten away from the single bag purchases, and now they get into a corner baggie. So picture a sandwich bag with about this much powder in it. So smaller than a golf ball, considerably smaller, but a little bit bigger than a jawbreaker. That's a gram. So now if somebody says to you, yeah, I do a gram a day, and you're like, well, wait a minute, I knew what a bindle was. What's a gram? A gram is 20 bags. So when I talk to someone, I say, what do you do? And they're like, yeah, I got about a gram a day habit. Wow, of heroin or coke? Because if it's coke, it's about 100. If it's heroin, it's a little bit more than that. And, are you shooting? Are you snorting? Are you drinking it? How are you getting it in? So there's just some things to give some thought to. Now, this is the awful part, okay? You walk into the OD. I'm a huge fan of getting Narcan out on the streets. Makes me one of the least popular cops for a period of time because it's one more thing that we're tasking them with. If they wanted to be EMTs or medics, and I hear this all the time, if I wanted to do that, I would have been on the ambulance like you. Oh yeah, but here's the deal. You show up to a heroin overdose. We're first responders. By law, we still have to do something. That patient's not breathing. So now I have a respiratory arrest. I feel for a pulse. I've still got a pulse. Great. Now I have a respiratory arrest call. I can assemble my Narcan, use it as taught, and the person may start breathing on their own, or they may become conscious. But through nasal Narcan, it's generally a soft reversal. They start breathing on their own. You're like, hey, great. EMS, I still need you to step it up, but the person's now breathing. Okay? All you're doing is helping that patient to hopefully recover more quickly. As Dr. Poteet said, you can do rescue breaths for 3 hours. It's not going to get them back. Now, we'll talk about Narcan a little bit more in a minute, but just some food for thought there. This one broke my heart. Now, I'm going to call this out to you. I think we should all learn from each other's mistakes. And this was not a mistake per se, but this was a circumstance where we allowed a courtesy, and it didn't go so well for a minute. So Section 35, you're going to hear about it this afternoon. We show up at a house. Yeah, you're Section 35. Let's go. And the young girl says, can I get dressed? Absolutely. Family's already been over to petition. Family's back at the house. No problem. We're just going to take you because we know you're a runner. I get dispatched to a second call from behind the closed door. My partner hears, and he goes, uh-oh. So the door gets booted in, and there she's standing with some torn open bags, and she had put 2 bags of heroin up her nose. Now, for some people, you'd be like, uh-oh, get the ambulance down here quickly. Guys, she was a gram or 2 a day user. So a couple bags just got her to stop shaking so she could actually walk down the stairs on her own. Still alarming. I gave him my Narcan kit when I got back. I said, here, you transport her to court. Her pupils look fine. You know, she's perfusing well. She's not pale. She's not nodding off. I said, how much do you use? She's like, about a gram, a little more a day. Okay. So 2 bags. It's still drugs. It's still bad. Somebody says to you, hey, can I just have a few minutes to gather something in my room? Never behind a closed door. Don't let them do it. I did ask her, do you have anything in the room we need to find? Because there were children in the house, and yes, I called in the 51A. Okay? Whew, finally, some laughter again. And she said, yeah, I got a couple empty bags. That's a Walmart shopping bag. That's probably 200 or 300 empty bags of heroin on the right. Big habit, okay? Big habit, scary, scary thought. Now, the packaging has changed, and then the picture on the right, the reason I put it in there is because it has something called Suboxone strips. We've talked about Suboxone, great questions earlier, you know, is it right, is it wrong, how long should they be using it? When it comes to strips, one of the things I want to warn you about is if you're doing a removal or you see strips and you're like, hey, we want to take that to support that maybe the child shouldn't be here. If you take a wrapper from a strip and I show back up at my Suboxone clinic on the 1st of the month to get my next 30 days and I show up with 29 wrappers, some clinics will say you're out. You sold one. I didn't sell it. Athol took it. State police took it. You know, it blew out the window. They have lot numbers. I let them keep their wrappers. Okay, we're not doing any good by getting them kicked out of the program. Yes, there's some street market for it, but not like the rest of the stuff. There's another works kit, all right? 3 needles, some cooking spoons, folded up. You can hide it in a makeup container. I've had them in a pen and pencil container and all sorts of different kits. Eyeglass kits are very popular, so on and so forth. Now, this is the only category of drugs that pins out the pupils. What do I mean by that? If I see constricted tiny pupils and you're outside on the patio at lunch, that makes sense to me. But if you're in here where the forward-facing or front lights are off, and I still have a 1.5 to 2 millimeter pupil, that is not normal. My pupil should be 2 to 5 millimeters right now. You're like, hey, I'm not a doctor. I don't know what that means. That means you should see it. Because if you walk up to me, or as the other day, 10 feet away, I'm like, pinned pupils, what do you take for pain management? I take 10 milligram Oxycontins twice a day. Yeah, you're not driving anymore. You're coming off the road. If you're that pinned, your drugs are working, your medicine's working. I'm glad you're not in pain, but I'm not allowing you to drive a 1-ton missile down the street where everybody else is out. So, pinned pupils, poor color, sunken features, purple eyelids, okay? Nail bed colors are off, chin to chest nodding off. If somebody nods off in front of you and you think, oh, hey, look at him, they hear everything you're saying. Just some food for thought on that, because sometimes some of the guys I work with say some things, and I'm like, they still hear you. Not so good. Officer Smith, you shouldn't have said that, right? We don't have a Smith. What's this? One of my testing candidates up in Lawrence, Mass. Those are her legs. Those are her calves. She's run out of veins in her arms, so she had to move on. It's an awful, awful drug. Cheese heroin, yes, it's true, okay? Strawberry Quick meth, it was just on Facebook again the other day. Nobody's making meth to look like Strawberry Quick, guys. You want to keep passing it around, go ahead. I'm not saying they'll never do it, but it's not common. But cheese heroin is. So it's Tylenol PM with heroin. Why? Because when my heroin wears off and gamma and mu, those 2 receptors in the brain that are looking for opiates, start screaming saying, hey, I need some again. I'm getting sick. If I'm on Tylenol PM with diphenhydramine or Benadryl on board, it says, no, dude, just chill out. You're cool. Okay, for another 4 or 5 hours, you're not going to be too dope sick, but when you wake up, you're going to need some. So they do mix it because of that long-lasting effect. It's called landing gear. Ecstasy, we're going to skim past it because I was lucky enough to skim some extra time. We're not seeing a ton of it, particularly not in pill form. You might see it every now and then. MDMA, 3,4-methylene dioxide methamphetamine, play that with words with friends and you get lots of points, so I'm told. I can't spell it. Hooked on Phonics didn't work. But this you will see. Crystal ecstasy. It's Molly. 2 to 2.5 years ago, House of Blues had overdoses, UMass was canceling concerts. It's out there. So you see something pink and crystal, and you're like, crystal meth. Yeah, you're pretty much right. It's 3,4-methylene dioxide, so it is a meth family member, but it's not the CNS stimulant meth, it's a hallucinogenic meth. Essentially, it's ecstasy. Shrooms, we're still getting them. We got some just the other day. They're far more popular out here in Central and Western Mass than they are in Eastern Mass. Vermont, very popular. But they're still out there. I hear they taste like crap. They make teas out of it. They put a ton of peanut butter on it and chew it down. Somebody's laughing because they're remembering college. If you see more than 10 fingers, there was something in the tacos. But so Why is this up here? Robitussin. You're like, yeah, that's the 80s and the 90s. No, it's back. Roboing is still out there. For your clients, it's still out there. Why? Because an awful lot of medicine cabinets have cough and cold medicines in them. You will not go to my medicine cabinet and find cocaine. Okay? But they sold it as medicine. The home remedy person in the early 1900s came to the house. Oh, your baby's teething? Give them some of this. And it had heroin inside. Kids slept all night. No kidding, right? Well, what's up with this? I can find it. I can abuse it. I can go online and find ways to cook it down. I want the DXM. I want the dextromethorphan in it. That's the active ingredient that makes us go to sleep when we're sick. You have 10 body systems. And I was going to draw them out for you, but we're really losing some time here. So just think of it. You got 10 body systems, one of which is your respiratory system. I put it to sleep the other night, and I'm like, whew, good, now we can get some rest. That's what this does. But it also affects some of the other systems, like your circulatory system, your neurological system. So if I use this, and I use it in excess of what's the recommended dose, I'm getting high or impaired. I'm going to pass out. The other thing is, when I go back to the Suboxone clinic, because let's say I'm in opiate treatment, and I walk up and they say, Mr. Buck, open your mouth, and they do a little swab, and they say, oh, good, the litmus paper didn't change colors. You're opiate-free. Absolutely I am. But last night I did 4 bottles of cough syrup, because they're only looking for opiates. I'm not faulting the program. I'm just telling you this is how people cheat the system. You walk up to them with a Fast 5 ToxMed cup and say, hey, I want to see that you're really drug-free. Boom, and put it down. While you're waiting the magical 2 minutes for the plus or negative signs to appear, look at them and say, what are you using for over-the-counter stuff? Whoa, not do you use, what are you using? Let them say, I don't use anything. Why are you asking? I just want to check your bathroom cabinet real quick. This stuff is still very popular. The next one is a killer. Coricidin cough and cold, 30 milligrams of DXM. The rest have 5 to 20. All right? I go, now most of this is behind the counter now, for good reason, although when we're sick, we don't like that reason. But it's behind the counter because we get to go to the cabinet, or excuse me, go to the shelf, rip it open, take out the foil pack, put it in my back pocket, and I walk out the store with the security strip still in the box, and then I chew these down. It's like doing PCP. All right? I've done lots of interviews with people or evaluations with people who abuse these things. They're off the charts. They look like The Walking Dead. They look like a PCP addict, and it's over-the-counter Coricidin cough and cold. So prescription meds, oxys, Percocet, Percodan, Endocet, Roxacet, okay, fentanyl, Dilaudid, vitamin D. Someone's like, I can get that at the store. I'm like, not this vitamin D, right? Because nothing else is working, so we give them something else to control the pain. We're familiar with this stuff. I just want to ask you, where are they finding it? At home, at their friends' homes. Okay? Yesterday, I buried a friend who died at home from cancer. And I usually use my other friend's story, but I'll use Gilly's. You're home on hospice care. You got a lot of meds at home, right? Well, as I looked up his obituary, I even put it on my Facebook wall. Died peacefully at home, surrounded by family. I hope that's true for all of us. Right? It kind of freaked me out 20 years ago. I'm like, if you die here, I'm not coming back here, right? So dies at home peacefully. Brave, courageous battle with cancer. In lieu of flowers, donate to the Relay for Life, right? Hospice of Greenfield, Hospice of Gardner. Oh, and by the way, from 2 to 4 and 7 to 9, we're all going to be at Fisk Funeral Home having a great Irish call-in hour. So whatever was in the house, now yes, hospice generally takes it, but we just put in the newspaper that Peter Buck died peacefully at home, surrounded by family from cancer, and we just told every addict out there that's looking for something where to go from 2 to 4 and 7 to 9. Got to give some thought to where people find this stuff. Fentanyl, it's out there. Long-term, it's a great pain management item. It is transdermal through the skin. Sometimes people are getting their hands on it. What they are doing, and this is why we've had so many opiate overdoses, is they cut it out, they squeeze out the syrup, they dry it out, and now the person overdoses because they think they're shooting heroin and they're shooting fentanyl. It has a far greater effect on the body. The treatments we've talked about, I'll just hit this real quick, and that is our nasal Narcan. I can't say enough about it. Okay? I have some at the house. Yes, I've used some of my own money. Yes, some other people have reimbursed me and said, hey, that's great that you did it. Other agencies are carrying it. If you find somebody in an overdose state, they cannot be charged with possession of a drug, simple possession. So 94C, 34, and 35, somebody gets an overdose call, and oh my God, there's heroin here, and I'm sitting here, and the cop's going to arrest me? No, it's gone. And a lot of people don't know that. So it doesn't mean that I'm encouraging people, hey, hang out with people that use drugs. What I'm saying is this. Stop sanitizing the area, taking their driver's license out of their wallet, putting it in their hand, and calling 911 as you're running down the street. Because that's what they do, guys. And they just did it last week. And she had no pulse and no respirations. And because one of my guys assembled a kit quickly and shot it up her nose and started rescue breathing, she's in the lobby to give him a hug 30 minutes later. Now, this isn't the awe moment that, you're like, oh, wow, good hook at the end. I just looked at him, I said, hey, remember 2 years ago you didn't like the idea of carrying Narcan? He goes, yep, enough said. So how often does somebody come back in and give you a hug and say, thanks for saving me? So it's just something to give some thought to. So thank you for giving me the extra time.
Thanks, Officer Buck.
All right, guys.
That was
Thank
very
you.
informative and entertaining.